Hi, friends. Hi, family. I came on here to talk to you about inflammation. But while I was scrolling, I noticed that there's a very popular trend. And I wanted to ask, do you know that there's something called the kissing disease? Yes, infectious mononucleosis is what it's called scientifically, but it's affectionately called the kissing disease, commonly caused by a popular virus. It's the Epstein-Barr virus, or for short, EBV. This virus belongs to the herpes family and is one of the most common viral infections worldwide, infecting over 90% of people at some point in their lives. I'll tell you more about Epstein-Barr virus and its implications in inflammation. So stay with me, because even though EBV can be the culprit behind a few weeks of fatigue and sore throat, it has a hidden, darker side. It doesn't just disappear after initial infection, it can stay hidden in our bodies, and we call that latency. What happens with a latent infection is that it quietly reactivates throughout our lives. And recent studies now are unearthing an important fact that EBV is not just linked to infectious mononucleosis, but it can also trigger or amplify serious autoimmune diseases. And because of that, that very common, well-known virus, the one that causes the kissing disease, poses a serious public health concern. So come along with me as we dive into the intriguing connection between EBV and autoimmune disorders. Some of the most strongly linked diseases include multiple sclerosis, or MS. Research indicates a staggering 32-fold increase in MS risk following EBV infection. Most patients had EBV before developing the disease. Then there is systemic lupus erythematosus, or SLE, or just lupus for short. Here, EBV rewires immune responses by infecting B cells and altering their behavior, leading to autoimmunity. B cells are our white blood cells that make antibodies which we need to fight infection. Then there's rheumatoid arthritis. Studies show that components of EBV are present in the synovial fluid of patients. Synovial fluid is the fluid between the joints, and so this hints at EBV involvement in the disease. EBV does this through several pathways, the first of which is molecular mimicry. EBV's proteins can resemble our own proteins, and they cause the immune system to mistakenly target itself. And I can't leave without sharing some vital information with those of you who look like me. Black women are 3 to 4 times more likely to get lupus. EBV, Epstein-Barr virus, is a key reason. So what can you take away from this? The relationship between EBV and autoimmune disease is clear. Talk to your doctor about your chronic inflammation. They will give you personal advice on how to treat your disease. While I'm not giving medical advice, we might not be able to prevent infectious mononucleosis or the fact that it's already latently living in our bodies, but we can certainly do something about having more resilient bodies. What can we do? What are some scientific ways that we can enhance or make our bodies resilient? Well, first of all, eat the rainbow. When I say eat the rainbow, I don't mean eat the rainbow that's in the sky, but all those beautiful colors, make sure that they're represented in your meals. You want to prioritize sleep, because sleep is non-negotiable for immune regulation. And you want to manage stress, because when you're stressed, the virus becomes reactivated. And when the virus becomes reactivated, this is where you have inflammation. Consider some key supplements like vitamin D, vitamin K, zinc, selenium. Those are some of the things that you need to talk to your doctor about. And next time you see a kissing trend, remember, it's not just a moment. It could have a lifelong impact. Protect your health from the inside out, because knowledge is power. And it's important to share knowledge with somebody who you'd kiss, because we are our brother's keepers. Remember, a merry heart doeth good like a medicine, and a broken spirit dries the bones. If each one takes care of the person in front of and beside him, everyone will be taken care of. I am Dr. Tamara, your online epidemiologist. Cheers. Take care now.